Thank you. Thank you so much, Joyce. It's really helpful. Just wanted to put a little bit of housekeeping out there. First of all, you would have seen it's being recorded. So please either turn off your video if you're not comfortable to have it on, but make sure that you have your mics on mute throughout, unless you're speaking. And please, throughout the session, feel free to use the chat, ask any questions, but we'll also have a Q&A at the end. So you'll have a chance to ask questions also at the end. Great, so I think we'll kick off. Can I just cross-check, because I don't have the full screen, Ailey, have we got any of our second speaker, in which case I'd like to welcome them now.
Martin's not on the call yet, Camilla.
No? Okay. So we're going to kick off. Let's kick off and we'll start with Joyce, and hopefully Martin would join. Just for those of you who weren't there right at the beginning, Martin, who focuses specifically on climate change in Amref and water and sanitation, Martin Muchangi, is currently in West Africa, traveling in West Africa, but he was hoping to have a good enough connection to join us, and if not, to ask a colleague to step in for him. So I think they're probably battling with the connection at this stage, and hopefully will join in a few minutes, but I'll kick off for now. So this supporter update is really about the food crisis in East Africa, and really trying to understand better what exactly is happening. And I think the causes are multifaceted, and Joyce will be able to speak to some of them in detail, and Martin hopefully as well. But among them is the fact that the region has experienced 4 consecutive failed rains, and more generally been affected and suffered erratic weather patterns over the last 10 years due to climate change. Now, this has led to a huge drop in agricultural production. The current estimates for the region are between 58% and 70% below average. And not only is there been a decrease in food and the amount of food produced, but also a decrease in actual pasture land and that is available for cattle, on which many people in the region depend for their food and their livelihood. People also in the region buy a lot of their food, and as you all have been experiencing, and Africa is no exception, food prices have shot up, and as a result of the war in the Ukraine. So those are some of the factors, and things like the COVID-19 pandemic and the conflicts in the region, and in particular, I'm thinking here, Ethiopia, have created even more fragile environments to cope with these erratic weather patterns and devastating food situations. So I just wanted to share with you a couple of quotes from a recent report by Oxfam and Save the Children, which estimates that the number of people facing crisis levels of hunger in East Africa has more than doubled in the last year and now reached over 23 million people. So really staggering numbers. And it's also found that more or less it estimates that a person is likely dying from hunger every 48 seconds across Somalia, Ethiopia, and Kenya. So really quite staggering and frightening, devastating figures, which really we're talking about people's lives here. And finally, before I move on to Joyce to tell us a little bit more on what she's seen and what she's experienced in the region and living in the region, I just wanted to say that the Guardian, a recent article actually in the Guardian, suggests that this is probably one of the worst of the Horn of Africa's droughts in over 40 years. So quite an exceptional situation, as well as a devastating one. So given this bleak picture, Joyce. Can you tell us a little bit what you're seeing among the communities that Amref works with, and can you tell us a little bit how people have been affected, sorry, and is it as bad as these figures and estimates suggest?
Thanks once again, Camilla. Please confirm that you can hear me.
Perfect, yeah, very clear.
All right, thank you. So currently what we are experiencing and what I'm seeing around the countries in East Africa is that there's severe food insecurity, and it continues to ravage through households and communities in the region. And this is in both rural and urban setups. So there is no place that is secure at the moment. And there seems to be no end to this, and the trend is anticipated to persist well into 2022, while primarily being driven by the impacts of conflicts within and without the region. So there's also the interplay with multi-season drought that is currently happening in most of the countries here within the region. This is coupled with floods and economic shocks on households' food and income sources. So what FuseNet is saying, the Famine Early Warning Systems Network, is that there is a crisis, and the crisis is within the integrated phase classification phase 3, and it might even become worse, and the outcomes might be even more impactful, and especially to the vulnerable groups, and they will be expected in most of the countries within the region, with the most severe outcomes anticipated in conflict-affected areas of northern Ethiopia, and conflict and flooded affected areas of South Sudan, and drought affected areas of southern Ethiopia and South Central Somalia. Of course, there are other countries that are likely to be, that are being affected by this and remain of high concern at the moment, specifically Yemen and Sudan, where there is ongoing conflict and civil unrest, and this continues to fuel protracted economic crisis, together with some drought affected areas of Kenya. And within the Kenyan context, is specifically in the northern region of Kenya and some parts of the eastern regions of the country. So many of those affected by these humanitarian crises are recently or protractedly displaced, including an estimated 16 million internally displaced people that are located across East Africa and Yemen, and approximately about 4.7 million refugees that are hosted within the East African region. The unfortunate bit is also that the key staple food prices have continued to soar. The prices have continued to soar high, and at the moment they're above average since January 2022, with the price of staple foods like maize, grains, and cassava flour and sweet potato being about 27% above the 5-year average. The impact of this protracted food crisis, and of course conflict within the northern part of Ethiopia, and conflict and floods in the southern Sudan region, political and economical instability in Sudan, and a unique 4-season drought in Somalia and northern and eastern parts of Kenya have eroded the household capacity to access food and of course income, thus widening the food consumption gaps. And what this means is that households are finding it harder by day to be able to access food, and more so nutritious and safe foods. And so part of the coping mechanisms is that many will go with only 1 meal per day, and this is not different in children. So as a result of the ongoing food insecurity, communities and households continue to be faced with acute shortages again of staple foods, including limited access to safe, diverse, and nutritious food commodities, something that is already having a negative implication on the health and nutritional status of the vulnerable groups, and here specifically the under 5 and pregnant and lactating women. So as is, we are seeing also elevated levels of acute malnutrition, which are within the critical range and quite associated with increased levels of excess mortality And this is again happening mostly in Ethiopia, in Kenya, in Somalia, in South Sudan, the areas that are experiencing drought that is unusual. So what is also happening at the moment is that the humanitarian food assistance plans for 2022 have been drastically underfunded, and the cost of procuring and delivering assistance have escalated due to global food and fuel price shocks. So basically, that's the context we are seeing here.
Brilliant. Thank you, Joyce. That's really helpful. There was just a question quickly in relation to what you were saying that I believe you're talking about IPC, the Integrated Food Security Phase Classification, which is in phase 3. Yeah?
Yes, please.
So there was just a question specifically to that about what that means. Do you want to answer that, or I can answer it?
I can answer and then you can add. So what that means is that the regions or the countries that have been classified as phase 3 means that it's a critical phase, and it means that households have started adopting negative coping mechanisms, like I had earlier said, like skipping meals or collecting wild foods, or making sure that the frequency and the amount that is served to the young children is not as per what is recommended, so that they can have an extra meal for another day.
Brilliant. Yeah, that's excellent. So basically it's emergency settings already. It's already no longer in a normal people are no longer eating normally, etc. They're considered in an emergency situation, and it's quite useful because it's a way of alerting the international community, international organizations, and the government to respond to a crisis, because it sort of rings the alarm, as it were. Hopefully that's helpful. So if people are starting to cut on meals and eat wild foods and so on, those are some of the indicators. Thank you, Joyce. And you've touched a little bit on what some of the factors that have exacerbated the current food insecurity, contributed to increased levels of malnutrition. But can you say a little bit more about what the main causes are in the region? So, what's different now, given that, it is a region that does suffer from drought, but this is really quite unprecedented.
All right, thanks, Camilla, again. So among the major causes of food insecurity in the region are associated with the inflated global food prices and commodity shortages due to the ongoing Ukraine crisis. But also there are a couple of other localized causes, like the locust invasion that happened between 2020 and 2021. Of course, these have since been contained, but the fact that it left an indelible mark among communities whose main livelihood is agriculture and livestock rearing, and they suffered severe destruction of food crops and forage, then it meant also there was death of livestock, and of course for the livestock keepers, they've not been able to recover the livestock that died out of that just because there was interference with the forage. There is also quite some level of insecurity, and because of insecurity, of course, people are unstable. They can't do their normal livelihood activities have been affected by insecurity, and so they're up and about, moving from one place to another to find secure places. But also the climate change and pandemics, and more so the COVID-19 outbreak that has destroyed people's livelihoods, especially for the self-employed, and more so the small enterprises, have led to job loss. And even for the people who are self-employed, they've been unable to revamp their livelihoods completely because they either do not have any capital to do it, or they lost their jobs where they used to fend their families from. And so they've been left at a dire experiencing dire situations. But also aside of the pandemic, most of these countries in the region are experiencing severe water and pasture shortages, livestock deaths, and below average harvest. And at the moment, 65% in Somalia and 70% in marginal agricultural areas of Kenya have been experienced as losses in these countries. This means that the normal harvest, the normal harvest has gone below 65% in Somalia and 70% in agricultural areas in Kenya. So as a result of this, there has been a sharp increase in cereals and other staple food prices, while also eroding household purchasing power, just for the same reasons I've given, that due to COVID and many other recent insecurity, households are not able to access food. They don't have the economical power to do that. And so all these factors, of course, have greatly impacted food accessibility as well as access to other critical health and nutrition services.
Okay, brilliant. Thank you. Thank you, Joyce, for the very comprehensive answer. I see there's a number of questions that are addressing more sort of what can be done. And I will come to them just to let you know, those of you who've posted questions, just following on the train of thought around communities and how they're impacted. And I just wanted to ask you, Joyce, how are communities responding? How are they coping? You talked about going to eating less meals. You talked about wild foods. What kind of things are people doing in order to survive, apart from some of those coping mechanisms that I just mentioned, which you mentioned?
So other ways that families are coping with this, of course, is not to depend on remittances from their relatives, and especially relatives who are living elsewhere and who are earning a living. And these remittances are what are sustaining most of the households. But other than this, the different governments in different countries are also offering food aid. Recently, we had Ethiopia, we had Kenya, we had South Sudan flagging off food aid. But of course, the food basket of this food aid is just the normal cereal grain. So it's not like it's a balanced, it's a nutritious food basket. And so, of course, now when the communities get this food aid, what they do is to trade it for an income, so that if it's supposed to last them for 14 days, for 2 weeks, then it's just lasting them a week, because then they have to meet other needs. They have to meet medical needs. They have to meet probably education needs at the very basic, bare minimum. And so, other than the other coping strategies that I spoke about, skipping meals for both adults and children, coping with wild fruits, and of course, maybe doing labor work, casual labor, so that you're paid a little for the day and you're able to afford just a meal for the family. Mostly, that's how we are seeing communities coping.
Yeah, interesting. And is the food aid quite well covered? So interesting point that you mentioned there, Joyce, around people wanting cash as opposed to just food, and therefore selling the food aid in order to pay a health medication or any other sort of health related issue, or education or other issue. Really, really interesting point around that, or trying to diversify their diet beyond just cereals. And I think a number of agencies are also giving cash directly as opposed to food aid to also address that. Organizations like the World Food Programme and other international organizations. But how well covered is the food aid? I mean, to what extent are these organizations able to reach people with that food aid?
So, of course, as much as the target is for people who are in dire need, people who are in phase classification 3 and 4 and 5, It doesn't necessarily meet everyone, because we also have these communities that are hard to reach, and especially the pastoralists who keep moving from one place to the other. So should there be food aid and distribution happening in their location and they've already moved with their livestock, then it means they're not able to be reached within that cycle. But just as you rightfully said, Camilla, is that other organizations are trying to complement these with non-food items and cash transfers, and of course giving vouchers also, just to ensure that women, households with vulnerable groups, women, pregnant and lactating women and under 5s, are able to eat a nutritious meal. But even that, we wouldn't say that we've adequately covered the needs of everyone. And the fact is that the needs are just covered for a period of time. It's not a sustainable way. The most sustainable way is to see whether these communities can be economically empowered so that they are able then to deal with their own issues in a more sustainable way.
Great. And Joyce, I'll come on to that because that links to some of the questions in the chat. But before that, my understanding is that obviously there's been, and you mentioned it as well, huge increases in acute malnutrition. And I was just wondering if you could talk to us a little bit about what Amref is doing, both to address that acute malnutrition, but also more generally around food insecurity and supporting communities across the Horn of Africa.
All right, thanks. I would like to state that Amref focuses, of course, both on emergency and sustainable solutions to addressing nutrition disparities as an integral part of its development initiatives, and actively integrates nutrition within the broader health interventions, specifically in water and sanitation, reproductive, maternal, neonatal, and child health programs, and within also some emergency programs that are already happening in Uganda and in Ethiopia. And this is happening, the integration is happening as opposed to vertical programming, to maximize on impact, but also ensure a holistic approach to health and nutrition. So the approach that is being used from one country to the other will vary, is currently varying based on the context, but across all the countries, Amref is upholding a multi-sectoral and multi-stakeholder collaboration for greater impact and sustainable health and nutrition outcomes. So among the ways that nutrition, Amref is responding to this while making sure that the vulnerable groups are at the center of all these, the adolescents, the pregnant and lactating women, and the under 5s, is that we have the policy and programmatic influence approach. And the policy and programmatic influence is through South-South collaboration, whereby mainly we are collaborating with the government, different governments within the Ministry of Health, which is our key entry point, but also with other key line ministries and multi-sectoral stakeholders to ensure that we are able to convene different governments and partners, and to provide a platform where countries can use for cross-country learnings and dialogues, and to share and to promote exchanges and adoption of successful and tested models that have had palpable impact on health and nutrition. So while at this, we are also working very closely with other organizations like UNICEF to just ensure that there's capacity enhancement of healthcare workers and community health workers through collaboration and developing customized online learning materials, so that then as they're responding to the disparities, different disparities at the community level, they're also better placed to enhance the capacity of communities. So at the moment, there is also ongoing in-person trainings among healthcare workers in collaboration with the ministry to just ensure that the healthcare workers and community health workers are better placed to be able to identify, screen, identify, and promptly refer children under 5 and pregnant and lactating women who are malnourished. But beyond that, there is also a very clear referral system, and a referral system that is working, whereby we are able to trace children under 5 and pregnant and lactating women who've been screened for malnutrition, and they've either been identified with severe or moderate malnutrition, to just ensure that they get to be rehabilitated and ensure that we don't have any mortality arising out of malnutrition. There is also, of course, community empowerment through continuous health and nutrition education among community members, so that then we are able to influence optimal feeding and care practices, and here promoting early, timely initiation to breastfeeding, upholding exclusive breastfeeding, knowing how far it can go, and also encouraging, of course, mothers to be able to breastfeed their children for 2 years and beyond. But beyond this, we are also ensuring that we promote apt complementary feeding practices and optimal health-seeking behavior, together with acceptable dietary practices. But you will also realize giving information is one thing, and we are giving information just to ensure that then we don't have children who are further deteriorating and slipping into the category of malnourished children. But now the how to do it remains another thing. Yeah, you've shared this information, they have the knowledge, and for sure communities know what to do, but how do they do it? Are we able to enhance and ensure that there is a clear linkage on the how to do it? And so how Amref is working to make sure that we address the missing link on the how to do it is empowerment, economical empowerment through income generating activities of women, so that then, because we know when women have it, households will always have access to food. So we are working closely with women to ensure that we can initiate some sustainable income generating activities, and also ensuring that beyond having the income generating activities, do they have information on what nutritious diets are? Do they have access and availability to these? Do they have sustenance? Are they able to produce probably these nutritious foods that we are talking about within kitchen gardens, and be able to preserve for periods that are lean? So it comes as a whole package. Food preparation package, food preservation, while of course adopting the traditional methods that they always know that they've always used, so that we don't erode any community knowledge that there is. And aside of that, Amref is also collaborating very closely with the Ministry of Health and other stakeholders to just ensure that we offer technical and logistical support for active case finding, so that our systems are not only reactive, but they are proactive. We keep identifying those who are at risk of malnutrition and making sure that the referral happens promptly, but they eventually also get to the centers where they can be rehabilitated adequately. So in summary, I would want to say that Amref has a niche in nutrition programming when it comes to capacity enhancement of healthcare workers and community health workers in maternal and child nutrition, specifically in maternal, infant, and young child nutrition and management of acute malnutrition among the under 5s and pregnant and lactating women, and provision of essential services, but making sure that they are an integral part of the primary health care and RMN care initiatives. And of course, the social behavior change communication, making sure that we have contextualized messages and that the SBCC strategies are very contextualized to address what the community needs addressed. Back to you, Camilla.
Thank you, Joyce. Thank you. Yeah, so again, another very comprehensive answer. So you talked about Amref's work addressing malnutrition directly, working with the Ministry of Health on improving and ensuring referrals. And then you also talked about the other aspect, which is working closely with women on improving economic activities and access to these activities and so on. I'll go back to that, but for now, a lot of people on this call will be familiar with community health workers and the work that we do with community health workers and other health professionals. I just wanted to know, Joyce, if you could tell us about what happens at a community level. What are community health workers actually doing to identify cases of malnutrition? And I'm thinking, using MUAC, which a lot of people on the call may not know about, but what are the tools and how is it done? And again, getting your take about how effective that is as part of an overall intervention to address malnutrition.
So as I had already indicated, is that at the community level, what the community health workers are doing is to actively screen for malnutrition, but also ensure that they work very closely with the caretakers and mothers of children under 5 to just ensure that even the mothers are well empowered. And so what is being used at the community level is MUAC, the mid-upper arm circumference tape. And of course, it is coded. It is coded with colors, red, yellow, and green. And the reason it is coded is because it needs to also be a friendly tool to use, even for the community health workers who might not be educated to be able to do the readings, so that if they see red, they know red stands for severe. If they see green, they know that green stands for at risk. And if they see green, they know that green stands for a child whose nutritional status is okay. So then after they go from household to household, and of course, as they're doing this, they're also consolidating it with other health services. And these other health services is to ensure that they check the vaccination adherence of these particular children within a household. They also make sure that they are up to date with their, other than the vaccination schedule, they're up to date with deworming, they're up to date with vitamin A supplementation. And so they also accompany these with health and nutrition education. So immediately they identify a child who is malnourished, whether mildly malnourished, moderately malnourished, or severely malnourished, then they make sure that they link them up with a proximal health facility. And so there is a very clear linkage between the community health workers and the health workers at the facility level. So within every facility, the health in charge at the facility level will know their catchment area. And within their catchment area, they know the number of households and they know the number of community health workers that are in charge of those households. And so they have to keep coordinating, and they have regular review meetings to just ensure that they are all working and thinking from the same level, and that whatever referrals are made, then they ensure that they compare notes with the community health workers. How many people have you, how many under 5s have you referred? How many pregnant and lactating women have you referred? And they counter check and see how many have eventually gotten to the health facility. And this happens just to make sure that we don't have any missing cases and we don't end up dealing with any mortalities that would have been reversed. But other than the community health workers doing this, of course, so quite often they have their capacity enhanced, and we have different tools and different platforms where they have access to just basic information. Like we have the LEAP, and within the LEAP, there the LEAP is a very basic, what do we call this? Is a very basic
mobile platform, yeah?
Yes, platform, yes, mobile platform, yeah, that can be used on any basic phone. So within these platforms, the community health workers are able to access basic information so that they are also at a better place to know what they're dealing with and how they're dealing with it. But the fact that they have their supervisors and they have the health in charges taking care of them, then they also have a direct linkage to get to clarify what they need to clarify at any given time.
Good, thank you. I just want to, if that's okay, I want to try and weave in some of these questions, Joyce, that we've got from participants, because they sort of link to some of the economic activities and that Amref is doing. And what are measures that can be introduced to ensure that people aren't so badly affected by droughts, which are likely to continue to be exacerbated by climate change. So one of the question was, since there seems little hope that the climate will improve, what is the outlook? And one of the suggestions is maybe the introduction of drought-tolerant crops or any sort of food and income supplementation. Is that something that Amref does? Is that something that other agencies do? What's your view on how effective these could be?
All right. So as I had earlier said, of course, Amref is working closely with other stakeholders so as to ensure that it's a collaborative effort, and where Amref is not able to like you've rightfully talked about drought-tolerant crops, the DTCs. So because Amref does not offer these services, what happens is that Amref works very closely with line ministries, as I had earlier said, Ministry of Health, Ministry of Agriculture, agricultural extension workers at the community level, so that then if we have a particular household that we are already supporting to ensure that we have the kitchen gardens, the home gardens. The home gardens can be in form of rearing small livestock or making sure that we are growing crops and crops that are drought tolerant. Then what happens is that we have seeds coming from the ministry or coming from other organizations like FAO or any other partner that is supporting a similar initiative. So Amref seeks to ensure that while we are addressing the issues that are at the community level, we have to map the stakeholders who are working within that locality and be able to map out the activities, the interventions that are happening where and when, to be able then to link beneficiaries to any interventions that are not necessarily happening within Amref. But also, as part of sustainability, what is happening again is to ensure that even where we have communities probably that are livestock keepers, like the pastoralists, Amref is working in arid and semi-arid areas. So what we do is to make sure that as we are offering health, it's One Health. We are calling communities to come and access health for their children and for their pregnant and lactating women. But within this same gathering, we make sure that we have the veterinary people who are going to attend to the livestock. We have probably the insurance fund who are going to sell their products and probably ensure that there's linkage to insurance, to just ensure that communities have more capacity and more empowered to be able to absorb shock, but also be more resilient. So it's a holistic. It's sort of holistic, because then where we are giving health services, where we are making sure that we are having nutrition interventions happening, then we tend to gather all the key stakeholders, having livestock interventions, having probably agricultural interventions, having education interventions, having interventions for adolescents, to just ensure that then it's one touch and the community is able to benefit from a range of services.
Great, thank you, Joyce. So Amref takes a very comprehensive approach and holistic approach, as you mentioned, working with others so that all gaps are filled. That's really helpful. And the other question, which sort of links, I guess, is what advice do we give communities to diversify their economic source of livelihood and ensure food security? Is that something that Amref will look into, or again, is that something more that it will work with others to achieve?
At the moment, I know it's already happening, and especially in the arid and semi-arid areas. And so how is it happening? Sorry, I want to remember your question, Camilla.
Yeah, sorry. So, so just more in terms of economic and livelihood diversification. You know, we're a health agency, so it's not really our specialism. But you talked about, you know, we provide information around diet and diversified foods and so on. Are there other things that we do more around income diversification, or do we work with others to do that? I don't know, Joseph, if you want to put in your question. Joseph, it was your question. I hope I'm not making a hash of it. Joseph, I don't know if you want to come in. You're on mute, Joseph.
Hello, can you hear me?
Yeah, I can hear. We can hear you now. Yeah.
Yes, I was asking Camilla was about maybe whether the Amref organization is advising communities, like maybe the community who have been doing pastoralism, whether maybe they could be advised to shift from pastoralism and maybe they think of doing farming.
Did you hear that? Okay, Joyce. So what sort of opportunities are there for diversification, for moving away from purely pastoralist way of life and a dependency on livestock and therefore on grazing land? What sort of, do you see any hope for that or any opportunity for that?
Of course, that's such a touchy issue, I must say. It's a touchy issue, and even with experience, with former experience from the Food and Agriculture Organization that was working very closely with communities that keep livestock, you cannot dissuade them from keeping livestock. But what Amref is doing is that then we link very closely with partners who are supporting, say, within the arid and semi-arid, and we are working in a pastoralist community. And I would want to give the example of Turkana. We know that most parts of Turkana, we have pastoralists, and you cannot dissuade them from selling away their livestock and adopting another way of living. You cannot. So what happens is that when there's drought, like they're already experiencing drought, you talk them into offloading. And what offloading means is that you connect them, we are connecting them to organizations that are doing offloading. And during offloading season, they are just able to sell their livestock instead of letting their livestock die. They are able to sell their livestock to either to some group. And what happens is that this group will either, if the livestock can be revived, then they are revived, they are fed through the period, they are given they are given fodder, and they are given drugs to make sure that they're not emaciated. And once the pastoralists then are able to get to a point where they can take back their livestock, then they are able to buy their livestock back at a cheaper price. But also how they are diversifying their livelihood, because the key thing here is diversification. Of course, Amref is talking, when we're giving consistent community education, is then we also give them options of, you know what, you can also start an income generating activity with your livestock. Say if probably you're rearing goats, or you're keeping sheep, or you're keeping cattle, instead of waiting for it to die, you can slaughter and sell it as meat. You can keep that money, so it can be in form of table banking if they are not open to keeping this money in banks. And when they keep it within themselves, then they are able to recover this money or do something with this money as they wait for a season when they can do restocking for their livestock. So it's to give them different ideas of how they can still maintain their livelihood and not do away with it, because if you try persuade them to do away with it, then you will definitely encounter resistance. And that's where I was also saying Amref then plays a role in convening. And how we convene is that if we are going to offer health and nutrition services, then we make sure that we bring other stakeholders on board, and these stakeholders will be coming in with different models of how these livestock keepers, the pastoralists, can still be able to carry on through the drought period, how they can also have communal land for growing fodder, like in Samburu, you know, and just to make sure that then we give them different options of how they can pull through the season without having to do away with their main livelihoods.
Thank you. Thanks, Joyce. Yeah. Hopefully that's answered your question, Joseph. It's a tricky one. But thanks, Joyce. I really like the ideas you put forward there as well, and that sort of more, that advice for a more a less radical approach, as in give up all your livestock, change your lifestyle, but you know, looking at offloading livestock at particular times of the year and so on, where you can still get good prices for your livestock. Really, really good thoughts there, Joyce. Thank you. There's another question, Les, from Julian around, and then I'll come to your question, Ryan, around malnutrition. But Julian's question is around whether can we also research the hydrogeology of Kenya? Is there a resource of underground water that can be tapped? And Julian, you're mentioning that in relation to drought-resistant crops. I don't know if you want to expand a little bit more. You're right, it's not our area of expertise, but Joyce might have some thoughts. And Joyce, I just want to say a huge thanks for sticking in there. You are being our prime and only speaker. It's quite full on for you, but really grateful. So Julian, do you want to just add to that?
Yeah, sure. And thanks, Joyce, very much. I mean, that's been some brilliant stuff from you, and it's really good to hear, right, you know, from the factory floor, so to speak. Yeah, water, you know, obviously is the start of all this, that we have increasing droughts. I understand that, and the reasons, well, let's not go into that. But there are areas of the world where water is short. I'm thinking back into Western Australia in the gold boom of probably the beginning of last century. They didn't have any water in Kalgoorlie, Western Australia, and they built a very expensive scheme. I'm not suggesting this is the way to do it, but they built a huge water pipeline and a series of pumps and dams from Perth where they had water. Now, I don't know the hydrogeology of Kenya very well. I should do, but I don't. I wonder if there's not a resource there to be tapped by water wells, and you can have water well farms pumping away and filling in dams and storage facilities. Has this been researched? Is there a geological department, well, there is, in Kenya, who are looking into this?
Joyce, did you?
Yeah, I'll just attempt with the little knowledge that I have. So what I know is happening in arid and semi-arid areas is that we are tapping onto water reservoirs, but also coming up with water pans. So if you might have heard within the Kakma refugee camp again in Turkana, what is happening is that as much as this is a very dry area, at the moment, the refugee community and the host communities are able to grow their own crops, and they're actually even able to sell surplus and make a living out of this. And how they are doing it is because they've been assisted by the stakeholders to dig water pans. And so what happens with the water pans is that water is collected, and so whether it's dry or rainy season, during rainy season, of course, the water collects, And then during dry season, we have water accessible to the communities. And then for the water reservoirs, I've seen this happening in Samburu. Samburu is another dry area in the northern part of Kenya. And so what they do with the water reservoirs is that they put up tanks, they pump in water here, and they're able to supply communities within some radius. And of course, when this is supplied to communities, it is for both household use, it is for the home gardens, but it is also for watering their livestock. I hope I've slightly answered you. I have little knowledge about that, but yeah, at least I've seen that happening around.
Great. Thank you. And just as we're still on sort of diversification, Joyce, a question from Carolyn on whether pastoralists are open to undertaking other types of activities, of handicrafts for sale, or other income generating activities, particularly among women who, as she says, are so motivated to provide for their children.
I forgot.
Any thoughts on that?
Sorry. Yeah, yes, Camilla, I actually forgot to say, I've seen, and this is while working, where Amref is working in some of these pastoralist communities in Ethiopia, in Uganda, in Kenya. We also have, other than promoting IGAs for probably just growing and sale of extra surplus food, we are also linking communities to small groups that are doing beadwork and are doing ornaments and basketry, and they are doing brilliantly. They are doing very well in this. So they are open because these are already, they have these resources within their community and the local materials are there. They only, so what Amref has done is to link these communities, the pastoralist communities, with someone who can build their capacity in, say, beadwork, doing ornaments, doing basketry, and they have a few sessions where they are learning, and immediately after they learn, they are able to do that, and they are also now linked to ready markets. So they are not only going to do it, but they have ready markets so that they won't have products that are not going anywhere. So Amref is able to link them to service providers who can enhance their capacity in using this skill, but also Amref is able to link them to providers that can link them to ready markets where they will not have middlemen exploiting them.
That's brilliant. That's really great. So able to link to markets where there's demand for these products and so on. That's fantastic. Thank you for your question. And then just to go back to Ryan's question, and this is thinking more, Joyce, around malnutrition and how we measure our impact, the impact of our activities on malnutrition. Can you say a little bit about that? The measurements that we use, the measurement of our impact?
Of course, the beauty with nutrition programming is that you have standard program indicators. And so even when we are working closely with the healthcare workers at the facility level and also working.
Oh. Joyce, I think we've just lost you. Joyce? Or is it just me? Ailey, is that just me or is it everyone?
I think
everyone. Joyce?
It may be, I see it happened exactly on the hour. Maybe she was timed for 1 hour to speak.
She was timed for, I think that it's supposed to be for 1.5 hours.
It is,
Ailey?
that's what it said on our invites. I've been on Zoom calls where they only book for an hour. And They chop you
Okay,
off.
let me just see.
I wonder if that's
And then they drop off. Yeah, thank you, Julian. Let's just, Ailey, if you can get back to, that would be fab. So just while we wait for Joyce to come back and and answer your question, Ryan. I hope Ryan's still on, actually. I haven't lost Ryan. Ryan, are you there? Trying to see. Great, okay. Just while we wait for her, are there any other questions or thoughts, reflections? Thank you, Matthew and Charlotte. Thank you for the message.
Thanks.
Now we're just waiting for Joyce to rejoin. I'm wondering, maybe while we wait for her, maybe it'd be good to reflect on your recent visit to Kenya and for you to chat a little bit more.
Yeah, so it's been, I think I mentioned it at the beginning of the call. I just came back from Kenya, which was incredible. And it was incredible not only because it had been 2 years since I had traveled to Africa, but also because of the quality of the programs I was able to see. And though they don't link directly to the food crisis, they do link to how Amref responds in a crisis. And so I visited 2 programs, both of them, again, very different. One was the program ending FGMC and the alternative rite of passage that we put in place, and the work that we do with ambassadors ending FGMC. And the other program was a program so that one, sorry, the end FGMC one was in Kajiado. And then I also visited a program in Kisumu, completely different area. And the program there addresses TB and malaria and is trying to decrease incidences of TB and malaria, working with local health authorities. And the thing that struck me in both cases, and which is so strong and comes out so strongly in the work that we do also in relation to the food crisis and food insecurity, is how we work with other stakeholders. So in both those programs that I visited, we're working very closely at community level with community health workers, with community champions, in the case of the end FGMC work, who know their community, who know how to approach difficult subjects, but also working at local leader level, so within the power structures of that community, then local health authorities, and then further up at national level and government level. And I think that's one of Amref's key strengths, actually, is being able to work at all those different levels, whether it's addressing end FGMC, whether it's addressing TB and malaria and trying to decrease the rates of TB and malaria. In that particular case, again, we're working with community health workers, had incredible conversations with the community health workers. And, you know, and just seeing the passion they have for their work and how respected they are for their work was really inspiring and moving and humbling all in one. But we also work with health authorities, with the different health facilities and governments. So really, really powerful that the way that we work at different levels to address any one health issue. And of course, that's exactly what Joyce has just been describing when it comes to the work that we do to address malnutrition and food insecurity. And specifically, I think what she's brought out there is the work that we do with stakeholders outside of the health sector. So not only are we quite comprehensive and joined up within the health sector, but we also link up outside, which again is really powerful as a model. I think we have Joyce back. So I'm just trying to find you, Joyce, on my screen. You might have zipped to the different screen. Bear with me. Joyce, yes, super. Can you hear me?
Yes, and I'm so sorry about that, Camilla. I had an interruption.
Yeah, no problem at all. So I was just reflecting a little bit on my recent trip to Kenya. Joyce, the question that was asked was around how we measure the impact of our activities to address malnutrition. Can you say a little bit about that?
Yes, I can. So when I was interrupted, I was just saying that what happens is that we have standard program indicators, and these program indicators are well articulated within the health facility, but also the community health workers are aware of this. So they are monitored at the facility level. And the program indicators, of course, to ensure that we are progressing well and we are making sure that the children who are being rehabilitated get to recover and do not relapse, is that we have to ensure the cure rate is within acceptable rates. We also have to ensure that the default rates are minimal within, if it's within a rural setup, they are below the number of children or women who are defaulting from the rehabilitation programs is not more than 10%, because then if it's more than 10%, it means that the program is not responsive enough. So at any given time, as I had earlier said, the community health workers work very closely with the health facilities to just ensure that if there is any defaulter just on one visit, they are followed, and we make sure we get them back to the program, just to ensure that all the performance indicators are within acceptable limits. But aside of that, of course, this is well aligned to other health indicators, and the health indicators that we monitor as Amref is like making sure that the infant mortality rate is within acceptable limits, the under 5s mortality rate, morbidity rate, and making sure, again, that's why I was talking about the vaccination coverage, making sure that the vaccination coverage is within acceptable limits. So we do not only focus on the program indicators specifically for the nutrition rehabilitation program, but as a holistic, because then looking at the indicators holistically are able to tell you at any given time the health you're able to have a feel of the health and nutritional status of community members. And all these indicators are within the DHIS. And the DHIS is, of course, a tool, a monitoring and evaluation tool for the government. But I would also want to add, within different programs that we are implementing, we have clear monitoring and evaluation frameworks. And so within these monitoring and evaluation frameworks internally now within Amref, we have key indicators that we normally monitor, and we make sure that whatever we committed to achieving is being monitored very closely within a rigorous monitoring system to ensure that we deliver.
Right.
Okay. May I intervene?
Kasahun. Sorry, we lost Joyce. Joyce, I think you've got cut short. Kasahun, do you have a question?
Yeah, not question, just to add on what Joyce, response.
Just say, yeah, great. Could you mind just introducing yourself to everyone, please?
My name is, okay, apologize for being late. I came very because of the connection. My name is Kasahun. I work for Amref Health Africa in Ethiopia. I am the program manager for disease prevention and control. and also oversee the nutrition project in Ethiopia.
Brilliant. Yeah, please add and welcome to the call. So yeah, you run a big malnutrition program, don't you, in Afar region?
Yeah, thank you very much. I mean, in Ethiopia in general, I mean, especially we measure the impact on major indicators like stunting. That means that shows the chronic malnutrition, and that shows the total the development of especially the country, because in Ethiopia the stunting level is around 38%, very high. Even in Afar, around 41%. That means 41% of children are suffering from stunting. That is their, I mean, low. I mean, they affect the development, the mental development, all affected. The child is affected. So stunting is very important indicator for the overall development. So government, especially the measurement of to measure the stunting level at different level, and this is done at community level. As Joyce said, it is the measurement being done by health workers, by community volunteers, and it's summarized and aggregated at national level to know the national stunting level. And also in the chronic malnutrition, I mean the acute malnutrition like wastage, weight for height, is one of the most important measurement that health workers do the day-to-day activities. So this is also one of the important things, especially in the area. This is the major important measurement to know the level of malnutrition, especially over, I mean, underweight also is the chronic malnutrition. So I mean height, age, height is very important to measure, so that the level of malnutrition to be known at national and at regional as well as at community level. Thank you very much.
Thank you very much. So Ryan, that gives you sort of a little bit more, both indicators, measurements of stunting and specifically weight for height. And age, and Amref monitors over time to see how it is improved. Thank you, Dr. Negash, for joining us, and welcome. Just another question. Sorry, I've just got another question from Julia in Amref Netherlands. And Joyce, can I just cross-check that you're still there?
Sorry, what did you ask?
Yeah, okay. I was just cross-checking that you were still there. Great.
Yes.
Thank you. But now we've also got Dr. Negash, which is great. So with regard to the holistic approach, do we also see an increase of harmful practices like child marriage within the affected areas as a consequence of the drought and food crisis situation? So Joyce and Dr. Negash, I mean, maybe Dr. Negash, just to start with you, as you're there in Afar, is that something you've seen? Have you seen an increase in child marriage because of what's happening in terms of the food crisis, loss of income, etc.?
Yeah. Yeah, I mean, actually is common in IDP sites, refugee sites, even in the community, because of the conflicts, especially girls, and that really now the government start to manage properly because the this rate become very high. So apart from food security, I mean, this also remain to be the serious problem and still I mean need to I mean do I mean more in this area.
Yeah. And Joyce, is that something you've seen as well more generally across the region? So increases in child marriage. Oops, have we lost Joyce?
Come back.
Great.
Yes, sorry, what were you asking? Sorry, I just dropped
is
off.
one of the harmful practices that people engage in to get more money is marrying off their children. And is that something that you've seen? So Dr. Negash was saying it's definitely something that they've seen in Ethiopia, increase incidence. Have you seen that more broadly in the region? So early child marriage. Or is it too soon to say?
So, yeah, of course, in some of the arid and semi-arid areas, it is a practice, though it's not a predominant practice, whereby families would want to sell off their young children just to earn a living. If they do it, they're doing it because it's more of a customary practice, but it's hardly because it's linked with food insecurity. This is not to say that it's not happening. It could be happening, but it's not at an alarming rate. And where it's happening because of their cultural practices, but not because it is linked to food insecurity in any way.
Okay.
Just to add, I mean, in Afar, especially in Afar, it's not common to have I mean, early marriage. I mean, traditionally, but it is common in Amhara, where the conflict is very, very high. I mean, traditionally, I mean, they give small girls for marriage. So the government prohibited for some times, but because of this conflict now, it rejects again. So that is the reason. I mean, it's increasing in Amhara region, but in Afar still it's not. I mean, accepted by tradition.
Thank you for that, for complementing that. So very much led by the conflict as well in Amhara and in Afar. Thank you, Dr. Negash. Great. I'm just aware that we've got about 12 minutes late and 12 minutes left, sorry. And I've got a couple of questions that I wanted to ask. But first, can I just ask in the audience, does anyone else have any more questions? And thank you so much, by the way, Joyce, for being our main speaker, as it turns out.
Yeah.
My pleasure.
Yeah, we just had Charles also say child marriage is rampant during and after the droughts and other disasters. Thank you, Charles, for this addition. The girls are given off in exchange of cows during the disasters and after as a form of recovery. Any more questions? Otherwise, I have no. Okay, so my question was really around what action is Amref taking to sort of better prepare for higher incidences of food insecurity and malnutrition. And I realized, Joyce, that in a way this was especially for Martin, but I wondered if you had any thoughts on what kind of action can be done in anticipation of there being more and more of these kind of droughts, and to better prepare to respond.
Yeah, of course, most of this is to try and build resilience, because if we don't build resilience, then communities will always be prone to shocks, shock after shock after shock. You see, we had COVID, now we are having minimal rainfall, we are having insecurity. So what I'm seeing Amref capitalizing on is longer term, how we can be able to link emergencies with long-term interventions so that we are also not working in silos, making sure that humanitarian work is being integrated well into development work and into peace building policies in conflict affected areas, to just ensure that the communities have more resilience and they are better placed to be able to address their own issues without every time, having to deal with having to deal with dire impact every now and then, because the more it's impactful, it negatively impacts on them, the more it takes communities time to recover. So here, of course, is making sure that as stakeholders, as Amref, and because we have the convening role, and that's why I was talking of also putting policy change into this, having structural changes taking place, ensuring that whatever is happening now, of course, to respond to emergencies, is not being done in silos. It is linking up to something else and something else, disaster risk management, and something else that makes sure that communities are more resilient and they can absorb shocks whenever they come. But also, we realize that there is a great role even as partners, broader partners, not only for Amref, to ensure that we scale up climate resilience across food systems, make sure that our food systems are resilient. Because if they're not resilient, there's an echo.
Yeah. No, continue.
Okay.
I think it's someone's.
Yeah. Okay. Yeah. So what I was saying is to make sure that we are scaling up climate resilience across food systems, and that's why we were talking of also making sure we have drought-tolerant crops, the DTCs, that can be able to endure the drought periods and be able to also and for communities to be able to have to still be able to produce their own food and to have surplus that they can sell. But also, as we do this, in my own opinion, I'm thinking it's also very necessary that we strengthen the resilience of most vulnerable communities through economic adversity, and making sure that we diversify their livelihoods so that they're not only stuck with one livelihood. How else can we make sure, even if they maintain their main livelihood, we have a diversification of what they have, so that if one is impacted negatively, they have something to fall back to. So other than that, of course, there is the bit of community empowerment, making sure that we have initiatives that are proper towards enhancing equality and making sure that there is financial empowerment. And this is by making sure that we intervene along the food supply chain so that we have we can influence and have lower costs of nutritious foods. As it is, what is happening with nutritious, if someone is even as we keep promoting healthy diets to communities, you realize healthy diets are very expensive when you compare them to processed and fast foods. So how do we make sure that the supply chain has lower costs of nutritious foods that can be accessible to everyone, and making sure that, of course, everyone has equal access and equal availability to these food items that we are talking about. Of course, we can only be able to achieve this also if we tackle poverty and the structural inequalities by ensuring that interventions, again, are proper and they are quite inclusive, and making sure that we strengthen the food environment and change consumer behavior so as to promote healthy dietary patterns that have positive impact on human health and the environment.
Thank you, Joyce. And Dr. Negash, did you want to add anything to Joyce's answer about what Amref is doing to be better prepared? No. Otherwise, I'll quickly go to Sister Joyce, your question. Any place in Africa where research is going on for drought-resistant crops? Joyce, any thoughts on that? the research institutes? I think there's quite a lot of work happening, isn't there?
There's a lot, yeah. There's a lot that has been done around drought-tolerant crops, even by ILRI, the International Livestock and Research Institute. They've done quite a lot across many African countries, and their site must be having a lot of information on drought-tolerant crops. Even ICRISAT must be having so many studies and research work that has been done around drought-tolerant crops.
Brilliant. Great, thank you. And just to close the last sort of 4 to 5 minutes that we have left, I just wanted to ask Joyce, and if Dr. Negash is still there, just what you would like the supporters on this call to do. What could they do to help in terms of the food crisis and addressing and supporting Amref with it, as it were, and our work on the ground?
Yeah, first, a call to work very closely. If there's anywhere we can work, the supporters can work with Amref closely, and especially in availing funds, so that we empower communities. And of course, when we're empowering communities, there are very many, we have many entry points to make sure that the community is empowered economically to be able to address their own issues without resorting to negative coping mechanisms. And what I can quickly think about is building resilience again, making sure that we work with communities and the local resources available to have income generating activities that can be sustainable. And of course, the income generating activities will favor the women, because if the women are empowered economically, then they will be able to take care of their children, they will be able to take care of the rest of the community members. And I would want to give a good example with Turkana again. This is where Amref is working very closely as we are doing maternal, infant, and young child nutrition. We are not only giving the communities information, we are also filling the missing link on the how to do it. So different ways that Amref is working with arid and semi-arid communities on the how to do it is introducing home gardens where we can be able to introduce them, but also venturing into other income generating activities like basketry, like weaving, like beadwork, and making sure, of course, we link them to ready markets. So that would be one of the areas. The other area is enhancing the capacity of community health workers. If we are able to enhance the capacity of community health workers, they will be more motivated to serve the communities. How? Because first of all, one entry point would be to come up with products that that the community health workers can use to generate an income. They are actually volunteers. Most of them work on voluntary basis on very meager salaries, if there are any. And because of that, they are demotivated to serve their communities. But of course, there are those who still continue to be motivated. So if we can have this category of people empowered, there will be a ripple effect. It will trickle down to their community members, because then they will learn a skill and they will make sure that their community members learn the same skill to earn a living out of it.
Great. Thank you. And this is sort of very much at the heart of Amref's work, and especially when it comes to the food crisis. So, Dr. Negash, yeah, come.
Okay, thank you. Yeah. Just to add on what Joyce said, I mean, community awareness about feeding behavior is very, very important, because most of the time, especially in Ethiopia, one staple food is common. I mean, despite there are many other products around. So in Afar, for instance, what we have learned, I mean, we had a project there in Afar, in the 3 districts. They don't have, I mean, experience to eat the egg while there is egg. So, so what we create awareness among women to prepare food, including eggs, so that the child gets protein, more protein for pregnant women, more protein. Also, to make resilient, especially empowerment of women through IJ. Apart from by the way, they use camel and sorghum bread. That is the only thing that eat. But there are many things that they can produce and being resilient and diversify food through food cooking demonstration session. That is the shortly, I mean, we had a project so that the people become resilient and know about nutrition in that specific area.
Thank you, Dr. Negash, and thank you for mentioning Amref's introduction of eggs in diets in the Afar region. That's been such a key activity as part of a broader malnutrition program addressing malnutrition in Afar region. So they weren't eating eggs, they're now eating eggs. And increasing their resilience that way and improving their diets. Thank you for mentioning that, Dr. Negash. We've run out of time, everyone. Thank you so much for, well, especially to you, Joyce, for sticking in there. You've been amazing, coming in and out when you could. And thank you, Dr. Negash, for coming in and joining us like that. That was a really nice surprise. So thank you.
Thank you very much.
We know how busy you are, and for also mentioning the diet improvement strategies that Amref's been doing in Afar. Great, thank you everyone for your patience on the tech side, as usual. And yeah, I think you agree the breadth of what we covered was quite astounding, and that's really down to you, Joyce. So well done. Amazing knowledge on all fronts. Pretty impressive. So thank you, and until the next supporter update, which we love doing it with the US and Canada. I won't chair next time, but we'll join. Thank you, everyone.
Thank you, everybody.
Bye.
Thank you. Bye.
Thank you.
Bye.
Thank you.
Bye, Dr. Negash.